Welcome to Ethnic Media Services virtual news briefing, which is the first of three we will be presenting with support from the Robert Wood Johnson Foundation, a national philanthropy dedicated to promoting health equity. I'm Sandy Close, Director of Ethnic Media Services and today's moderator. On a personal note, I want to add that Robert Wood Johnson Foundation supported the first National Expo of Ethnic Media at Columbia University in New York City back in 2005. And it's such an honor to reconnect and help expand its communications outreach with the ethnic media sector. Today, we explore the vital importance of disaggregating data, a topic ethnic media have long advocated for as vital to the health and well-being of our audiences. Today's news peg is the decision by the Office of Management and Budget, OMB, for the first time since 1997, to expand its race and ethnicity standards to capture historically excluded communities who will now be visible in federal data collection. Our speakers will explore what the updated race and ethnicity standards include, how OMB plans to engage with communities to ensure their broad adoption, the need for additional testing and research to implement the standards, including and especially at state and local levels, and what states are already implementing high standards and what states are falling far behind. Our speakers include Tina J. Kauh, Senior Program Officer within the Research Evaluation Learning Unit of the Robert Wood Johnson Foundation. Gail C. Christopher, Executive Director of the National Collaborative for Health Equity and Director of the Robert Wood Johnson Foundation's National Commission to Transform Public Health Data Systems. Meeta Anand, Senior Program Director, Census and Data Equity at the Leadership Conference Education Fund, and Juan Rosa, National Director of Civic Engagement at NALEO Educational Fund. We ask reporters to enter questions in the chat and urge our speakers to monitor the questions and respond as you see fit on the chat. It makes for more, it expands our ability to address questions. We will send a video of today's briefing with expanded bios for each speaker later today. And we will send video excerpts of the presentations early next week, which our media and which we hope the organizations that our speakers work with might find useful for their websites and social media posts. And now we welcome Tina Kauh from Robert Wood Johnson Foundation. Please go ahead.
Thank you, Sandy. Hi, everyone. It's an honor to be a part of this briefing and to represent the Robert Wood Johnson Foundation. RWJF is a leading national philanthropy dedicated to taking bold leaps to transform health in our lifetime. Through funding, convening, advocacy, and evidence building, we work side by side with communities, practitioners, and institutions to get to health equity faster and pave the way together to a future where health is no longer a privilege, but a right. One way we do this is by supporting research and filling the gaps in data that deepen and shift our understanding of health and well-being. I want to frame why the Federal Office of Management and Budget's recent changes to its minimum race ethnicity data standards is such a historic event, particularly for addressing gaps in data, by first telling you a little bit about my own personal story and why I'm so passionate about this work. My parents
Tina, could I ask you to go just a little more slowly? I just got a signal from an interpreter. We don't want to miss anything you say.
Sure, happy to. So my parents were first-generation Korean immigrants who came to the United States in the late 70s. And for over 3 decades, over 30 years, they owned a corner store in Philadelphia, Pennsylvania, where they worked 14 or 15-hour days, 7 days a week. And those days were physically demanding and socially isolating. On a daily basis, they had to navigate numerous cultural and language barriers with customers, teachers, doctors, and others they encountered on a regular basis. The well-known model minority myth would claim people like my parents were thriving because they were such quote unquote hard workers. But I saw firsthand how the challenges that they faced impacted their social, emotional, and physical health and well-being. As I met Asian American peers who shared a similar background as I got older, I realized that my parents' experience was not unique, but it's not a story that's told very often. If you do hear pieces of it, the narrative isn't focused on their struggles, but rather it's often framed within the light of, look how hardworking Asian Americans are, and look how they're succeeding because of that hard work. I first became really interested in studying the Asian American experience in college when I took a psychology course. And in that class, I realized there was a whole field of research that explored how culture, race, ethnicity influence attitudes and behaviors. And that started me on my path towards studying the well-being of Asian Americans. But when I started my doctoral program, I quickly realized that there weren't really many data about Asian Americans. And much of what did exist focused on educational outcomes, exploring questions like, why do Asian Americans do so well academically? Again, pushing that narrative of Asian Americans as the model minority. And after I received my doctorate, I was officially a researcher, and I sought funding to study the health and well-being of Asian Americans. But it was nearly impossible to find funders who thought that that was a worthy topic. As a funder, I've asked grantees to examine Asian Americans in their studies, but their sample sizes were too small, or there was interest, but it was too expensive to include them in any meaningful way. And even though I'm a funder, it was difficult for me to justify the need to significantly increase budgets because there was so little data to demonstrate why it was necessary. And trying to meaningfully study a smaller subpopulation within the broader Asian American population realistically wasn't feasible. What I want to call attention to is the fact that structural and systemic racism are driving the lack of data, not just for Asian Americans, but for other populations as well. It's rooted and deeply embedded in research practices, and it's just how things are done. The racial stereotype of Asians as the model minority perpetuates a myth that they're all faring well, which contributes to the notion that we don't need to make a special effort to collect or report data about them. But then without those data, we can't make the case about inequities that they're experiencing. It's kind of this vicious cycle. As a result, they're often lumped together with other ethnic and racial populations like Native Hawaiians and Pacific Islanders, or just put into a generic category called other and are essentially rendered invisible because their numbers are so small within data. With the changes recently made by the OMB, we now have an exciting opportunity to improve how race and ethnicity data are collected, analyzed, reported, and disseminated to advance health equity. The OMB's minimum standards still put individuals into broad categories that can mask significant heterogeneity within those populations, but changes like the creation of a new Middle Eastern or North African ethnic category now allows a growing community to be visible in national data for the first time. This is a key step that will better reflect the nation's diversity and lead to more equitable distribution of resources and more targeted interventions from government. Other recent changes to the OMB's minimum standards include measuring race and ethnicity using a single combined question on federal surveys, and requiring, instead of simply encouraging, the collection of more detailed race and ethnicity data by all federal agencies. And I'll say a bit more about this last change in the next minute. These changes will go a long way toward more fully capturing America's growing diversity, and not only in census data. The new standards apply to all other federal data, like data related to housing, healthcare, employment, and education, as well as the state and local data that need to be reported to federal agencies. I think the thing that most excites me about the OMB's changes, though, is the fact that they will influence the field of research at large. Many researchers, regardless of whether their data will ultimately need to be reported to a federal agency, use OMB minimum standards as the default approach for collecting demographic data. And as a result, these changes have the potential to truly change the field of research and data systems that inform strategies to promote equity in health and well-being. RWJF is committed to transforming health knowledge systems by supporting equitable and anti-racist practices in research. We want to support changes that need to happen in data systems, including things like who is worthy of having data and who gets to have input on how to interpret those data. For almost 10 years, the Foundation has worked with experts to advance policies and practices so race and ethnicity can be disaggregated in more meaningful ways. And the OMB's changes are a huge first step towards that goal, particularly the new requirement that detailed race and ethnicity data must be collected. However, a really important caveat to that new requirement is that agencies can essentially request approval to opt out if doing so would be too much of a quote-unquote burden on the agency. Now, recall my earlier point that systemic racism often drives decision-making about who is worth the effort to collect data about. So in that approval process, for allowing agencies to be exempt from collecting the detailed subgroup data, it's critical for the OMB to ask themselves questions like, who gets to decide what's the burden? Whose perspective is being prioritized in that decision-making process? Is it that of the ethnic or racial group? And if not, inequities will persist within the nation's data systems. In addition, more work needs to be done to ensure that all people see themselves in the broad ethnic and racial categories. Survey respondents will need well-structured questions with sufficient prompts and signals to individuals that they should check all the categories and provide responses to open-ended questions that they feel apply to them. And to ensure that these updated guidelines truly advance health, well-being, and equity for everyone, strong implementation is critical. And that means devoting ample resources at the state and local levels and working in tandem with community-based groups. RWJF looks forward to supporting those efforts to ensure swift and effective implementation of these updated standards so that everyone in America is counted and seen. Thank you.
Well, thank you. That is tremendously helpful. I have a quick question before I go to a question on the chat, and that is, how will we in ethnic media know what agencies opt out? It is hard to track so many different federal agencies. And are there agencies where our coverage, our questions, are calling out for a press conference with them to explain why they have opted out, might put some encouragement to them not to opt out? How are we going to know?
I mean, that's an excellent question. And to be honest, I don't know the details of this process, but my understanding is that there will be a comment period that will be opened up to the public. That I think it might be, Mita might be able to answer the question of, is it the OMB who is requesting comments? But I'm not sure, but I can definitely try to find out.
Wonderful. And a second question from my chat is, how will we be able to find out what specific groups within the broad Asian American category have been sort of spotlighted? There's so many groups, and I think of very small groups, not so small, but very important and often invisible, like the Rohingya. how extensive is the breakdown that OMB is asking for collecting data?
So in the questions, in the census form, you have Asian American as an ethnic or racial category. And there are, I believe, 6 categories that you can kind of choose from, but then there's also, if you don't fit into any of those 6, there's an open-ended blank space that you write in which subpopulation you feel like you belong to. And then on the back end, the census does some coding. And I think there's a little bit of lack of transparency in what that coding process looks like, but that is something that also many social justice groups are kind of pushing for as well, greater transparency around that process.
Terrific. Thank you. Just because of the interests of time, I'm going to move to our second speaker. Please do check the questions on the chat. And if you feel like answering any of them before our final round of questions, please do. But thank you so much for an excellent overview. So we now welcome Gail Christopher, who will be our second speaker. Ms. Christopher.
Thank you very much, Sandy. And Tina, thank you for that broad overview and that very compelling story of your family's background. I am always reminded by my children, my adult children, and others that the diversity of this country has the potential to be our superpower. But in order for that to be realized, people have to be counted. People have to not be invisible. And when it comes to the health and viability of our democracy, we simply must have systems in place that count for the lived experiences of our diverse population. And that's why this moment in time, in many ways, is a follow-up to the moment that some media folks called a racial reckoning in this country. Now, we really didn't reckon with our racialized past in a complete sense, but there were a lot of steps taken to move us forward, and they're still being taken. I am reminded of an African proverb which says, "To stumble is not to fall, but to move forward faster." And I think we're in that kind of moment. We have this opportunity to move forward faster. These changes in the data and the opportunity to disaggregate the data with more specificity, this is a moment of moving forward faster for our country. But we really have to engage the broader nation in the importance, in the primacy of this opportunity. So I'm so excited that all of you are here representing the media, because most of our progress in terms of human rights and civil rights, the media has been a major force in creating narratives, in helping to dispel false narratives. And so this is a very important time. Now, I personally have devoted my entire career to working to achieve health equity and racial equity. And part of my journey came from my own experiences of loss. Like so many African-American women, I experienced infant mortality in terms of lost my firstborn child. But more recently, I was a candidate for surgery, and my well-meaning physician decided that the stereotypes, or what he believed was typical of African Americans, without, I think, the real evidence to support it, but with what he thought was a well-intentioned effort to prevent the extreme inflammatory response that had been associated with African Americans. And many of you may know there are many algorithms and clinical protocols that are based on stereotypes and not accurate perceptions of many diverse communities. But based on a particular stereotype, he decided that he was going to really increase the dosage of the medication post-surgery dramatically. And the result of that was the loss of the vision in one eye because it was ocular surgery. And I recognized that he was well-intentioned, but it was really a stereotypical understanding that drove his decision-making. And as a consumer of healthcare, you know, we tend to do what we're told to do by our practicing physicians. So I've had a personal encounter with this importance, with the importance of making sure that the right information, the right data, but perhaps most importantly, moving us beyond the capacity and the tendency to apply stereotypes, as Tina described so fully, narratives that are not really accurate in a true disaggregated way. I was privileged to lead the Robert Wood Johnson's unprecedented commission to transform public health data systems. And this group, this diverse group of public health leaders came together and produced a report that has had an influence, recommending that we center equity in our work to transform public health data systems, in our narrative about transforming public health data systems. We also recommended that communities, local communities, be completely engaged in this work. And the fact that OMB made this decision, this is really, to a large measure, the result of community advocacy and nonprofit advocacy and leaders in the health equity space. And finally, of the many recommendations, the last large category had to do with being willing to address the legacy of structural racism that has characterized our nation and continues to. And so there were many recommendations within those three broad categories, but we're feeling really good that this monumental change has come. And we know that it's through the work of advocates and leaders and organizations all over this country, but it's just the first step. It is a floor, not a ceiling, in terms of what has to be done to transform our data systems and to disaggregate our data so that it is a more accurate representation of our superpower, our diverse communities. We know that there will have to be a lot of resources invested to make sure that the implementation is appropriate and that communities, public health leaders, local agencies, that they understand that doing this is in all of our best interests. You know, we are bombarded with polarizing narratives today, but we don't have to make this part of that. What we can do is recognize that we will all benefit when our information and our data is truly reflective of the diversity of our country, and our resources are subsequently allocated in ways that will give everyone an opportunity to truly thrive. So I am honored to be here with you today, and if any questions emerge that I can answer, Sandy, I really appreciate you giving them to me because I won't be able to see what's in the chat today.
So Gail, Sandy's having a little bit of trouble with her laptop, but yeah, so she asked me to take over, and I'm happy to do so.
Okay.
So in our pre-brief, I think you discussed the fact that agencies do this on a voluntary basis, and then they can opt out from implementing OMB's new standards. Is that correct? And how exactly will that work?
Well, I can't tell you exactly how it will work, but I can say that any transition, particularly at the government level, is usually associated with a period of learning, right? A period of implementation. So there is this statement, you know, in the recommendations that those agencies that feel it's an excess burden can opt out. But this is where the media and the communities can be the advocates to actually, I won't say demand, but to put some pressure on these agencies to be fully engaged. And this is where our public health infrastructure that exists in the country today can help to provide the transparency to let us know, in fact, is the agency adhering to these new standards. But once again, I really want to reemphasize that this is a narrative opportunity in which local and diverse media can play a very important role.
Thank you. And could you broadly speak on the impact to Middle Eastern and North African populations? I mean, that was historic. The fact that they're now being included as a category is monumental.
It is monumental, and it helps to dispel the myth, because previously not being included, I believe many of these groups were forced to self-identify as a race other than or ethnicity other than their own. And so it has to be very important to suddenly be visible, to be recognized, and to matter in terms of our nation's demographic data. You know, during the pandemic, over about 50% of the cases, we didn't have demographic data about race and ethnicity. And that's really not acceptable in a nation that is as prosperous as ours. And so this move to truly collect all the meaningful data and then to disaggregate it and make it available at state and local levels, this is an important positive result of our experience with the COVID pandemic.
Absolutely. And you talked about your personal story with the healthcare system, misidentifying your needs post-surgery. What would accurate data have done in your situation, for lack of a better word?
Well, you know, when we talk about data, we're not just talking about medical data and algorithms and clinical dynamics. We really are talking about the social determinants of health as well. And we're talking about painting a more realistic picture of the diversity within the diversity. And I think perhaps it was more of a stereotypical mindset than the absence of data that may have influenced that decision-making by that particular doctor. So I also think the challenge we face, the disaggregation of data fits into the broader construct of overcoming our legacy of discrimination and racial stereotyping, which is part of our nation's history. And this moment in time is a time in which we are beginning to own that history and beginning to put creative forces in play, healing and reconciliation and truth processes and, you know, debiasing work. We're definitely moving forward in a way that will hopefully make other people less at risk for being misdiagnosed or mistreated based on stereotypes. Is that helpful?
Absolutely. Could you tell us, is your vision back or?
Well, my background is holistic, and so I'm doing everything I can do. And most recently, I am starting to see an improvement, although this particular incident happened several years ago. But yes, things are getting better.
Well, thank you so much for joining us, Dr. Christopher. We move on to Meeta Anand. Meeta, welcome.
Thank you so much. And before I start my remarks, I have to say two things. One is Gail Christopher is such a hero, champion. I don't have enough superlative words to describe Gail Christopher, and it's just an honor to be in the same space as her. So really, thank you so much. And I also have to say, Tina is a visionary. You heard the story of how this all came to pass from her end. It was her vision that helped fund the work that the Leadership Conference Education Fund has done in this space. And we were able to bring together a coalition at the national level to really push for this, which was really a product of that vision. And we operate that vision at the state level as well. And I'll talk a tiny bit about how this also has implications at the state level. So I just really wanted to pay homage to these two extraordinary women who had the vision to help us get to this moment. I want to say one thing before I delve deeper, which is that one thing we all need to remember is that data are always contextual. To just say a data point is meaningless. And so when we have disaggregated data, what we are truly saying is that we are allowing people to tell more of their own personal story and more of their own lived experience through the data. And they are not being forced, as Gail just so eloquently put it, to identify as something they are not. And what happens when people start identifying as something they are not, it means that the rest of the story is not according with them. So that means that that when we put the data points together, we're not getting the true complete picture of what inequities we're facing in society. What are the differing outcomes? And we need to remember that when we're talking about collecting data, it is in service of these deeper understandings that we hope to address. These new standards, well, since everyone else has told a personal story, I will tell mine, which is that my mother is from Haiti, my father is from India. Growing up, I did not have much of a choice of what to put on a form. There was no such thing as multi-select. There was no opportunity to truly reflect who I was, and I hung out in that, famous other box that we've been talking about. In recent history, you can multi-select, and that's helpful. But, I will say this, I will always have to multi-select. No one's going to ever create that special little box that's just for me. But what I'm able to do is get as close as I can as possible. And that's what we want. We want to get as close to people being able to be seen and felt. So now when I look at forms, I do have options versus when I applied to college, and I won't tell you when that was, I made my own little boxes and filled them in and then checked them in order to indicate my background. So what this gives us is flexibility. There is some consternation amongst some groups about a single combined question. And I understand where it comes from. But what's great about this is that you can check Asian and Black. You can check Asian and Hispanic. You can check two different ethnicities within Hispanic. This really allows us in our country, as we start seeing more mitas come into the world, because more and more people from different backgrounds are meeting in our country, and they are having their own children. And we continue to see the diversification, and we need to have that flexibility to allow people to see themselves in the form. We heard about MENA. Well, MENA is an ethnicity, but you can be white and MENA, you can be Hispanic and MENA, you can be Black and MENA, or you can just be MENA. What this does, it allows people to truly reflect how they are experiencing living in this society. I wanted to go quickly before I talk about the states to a few points that were raised. A lot will have to do with implementation. We will have to ensure that the agencies, which have 18 months, so now 16 months, to put together their plans of how they plan to implement this. And then they have 5 years to implement this. So don't expect your next federal agency form to reflect this. It will take some time. And we really want to push the Office of Management and Budget and the Census Bureau to research, how do we indicate to people, look at this form, view it flexibly, see what identities reflect you, and pick those categories. You are encouraged to pick one or more than one, but really use this as the chance to tell your story. We need to have coding understanding. Like once we check it off, there's a step, multiple steps between that moment and what you see coming out of your computer if you go to data.census.gov, because they translate it and tabulate it. And even disaggregated data gets aggregated. So we will have to keep a close eye on what that coding looks like. And then I think someone asked about data disaggregation and how do we know which agencies will be doing it and not? Well, first of all, hopefully, organizations such as my own will be keeping an eye on these things and keeping you up to date. But also, the agencies, if they do not want to do mandatory data disaggregation, they will have to make an application to the Office of Management and Budget and demonstrate why they cannot do it. We don't know what that process will look like yet. So advocates such as my organization, such as Juan Rosa's organization, will be looking at, okay, what process are you developing? Maybe recommending our own process of what it should look like. And keeping into account structural racism that was just brought up, simply the cost, like it's too hard to change our systems, should not be an acceptable answer. And here's the good news. We are changing the systems because we've added a new category, MENA. So people have to change things anyway. So hopefully we'll be able to overcome that burden of this is too difficult. I did want to address the privacy question with data disaggregation. That's always going to be a hard question. What I do think, oh, someone's put an answer here, and I think that's right. I think the answer is you have to engage with communities and come to a balancing test as to which community you're talking about and for what purpose are you collecting the data so that you can make an appropriate determination for that scenario. I don't think that's a one-size-fits-all answer. I think I'm running out of time, so I can stop there and come back to talking a bit about what states are doing when we have a bit more time at the end.
Fantastic. And Mita, I wanted to ask you, why 5 years to implement a simple form?
Am I allowed just to say it's the federal government? Yeah.
Yeah. Good answer.
I mean, it is a simple form, but there are actually many things that go behind it. You have to think about how there's a computer, there's the processing that goes behind it for the computers. They're like for the software programs, you have to think about all our data up until this moment have not been collected in this form. So how do we bridge? Meaning, how do we have the old data talk to the new data going forward? And what does that look like? It will probably involve some sort of audit of where are we collecting these data and where do we have to update it? What I think is exciting, and this is for both the federal and state level, is this provides an incredible opportunity to really sort of leapfrog for those who have not been keeping up with having race and ethnicity data standards updated, or people who are not doing disaggregated data. This is an opportunity to say, let's look at what we're doing and use this as an opportunity to update it or go even further, because again, floor, not a ceiling. So it really is about like that audit component, which forms, what does the back end look like? How do we have it communicate with past data?
Absolutely. Henrietta Burrows has a question for you. Henrietta?
Yes, thanks so much, Sunita. Maida, as all of the individual data is collected, who oversees how it's used as government administrations change? We hear what Trump is saying he's going to do as a dictator. So what protections do we have?
So when someone has determined they do not wish to follow the rule of law, I am not sure what protections we have. I'll just say it bluntly. That said, data collected by the Census Bureau are protected by Title 13, which is the strongest privacy protection within the federal government. There are very, very strong firewalls in place throughout the government. What I will say is just remember that it's not just the federal government that we are relying upon to understand our communities. So some people are worried that we might not see implementation of this with a change in administration, but we can encourage states to collect the relevant data and use it carefully. Your other question is, how is it used? And what I have to say there is we are all going to have to be watchdogs and make sure that these data are used for good and not for bad. And we are going to have to be vigilant in a scenario where we feel that the data are being used for nefarious purposes. But until that point, I would encourage us to take heart in the protections of the agencies and the incredible dedication that a lot of the civil servants within the agencies have towards truly trying to get to the best outcomes for our communities.
Thank you, Mita. Before we move on to Juan, Tina, you had made an excellent point in the chat about the hardware and software. Could you just repeat that for our audience that is not looking at the chat box?
Sure. So the question was, why is it so hard to add just, a couple of questions? And I think the reality is that research and data systems, the actual hardware and software, have probably been underfunded in the past, and a lot of things are kind of made piecemeal. So I think many of us probably have the experience of, we have one system that's meant to do one thing, and then you try to add on to it, and so you make a little change here and a little change there, and next thing you know, you're still using that same system 20 years later, and it's probably not the most efficient way of doing it, but to start from scratch would be really expensive. And so that's partly why it's so hard to add even just one question, because it's not just adding a line of code, it's about really changing the software and the hardware infrastructure that an agency might have in place.
Thank you, Tina. Our final speaker for today is Juan Rosa from NALEO. Welcome, Juan.
Thank you very much, Sunita, and thank you very much to Sandy and everyone at Ethnic Media Services and my co-panelists today. Thanks so much to the reporters and writers who joined this call to learn more about how these updates to the federal standards could benefit our communities in the long run. So as Sunita mentioned, I am Juan Rosa, the National Director of Civic Engagement with NALEO Educational Fund. NALEO is a sort of a two member organization. One of us is NALEO Inc. NALEO Inc. is a membership organization founded in 1976 to bring together the nation's Latino elected and appointed officials. That work continues today. Our organization brings together these policymakers to do professional development, to learn about issues like the ones we're talking about here today, how they can champion these changes wherever they are in elected office or in appointed office, and for them to form networks and alliances that can help them advance these changes in their communities. Our other organization, the one that I actually work for, NALEO Educational Fund, was founded in 1981 with the task of getting Latinos more engaged in America's political processes, from elections to pursuing and attaining U.S. citizenship, to participation in the decennial census, and in the redistricting processes that follow the decennial census. Our CEO, Arturo Vargas, who has been with the organization for more than 30 years now, has actually served on various advisory boards and advisory committees for the U.S. Census Bureau, including most recently being named the chair of the 2030 Census Advisory Committee. We've been working on census participation since the 1990 census, because we are part of a mission is to ensure that there is a complete and accurate count of the Latino community, the Latino population in this country. Our work mobilizing our community, educating our community since 1990 led us to be very active on policy issues and the policies that affect the Census Bureau, from its funding and how it is getting ready to count the population every 10 years, and between the decade through processes like the ACS, the American Community Survey, and other tools that the census uses. That led us to, again, advocating for adequate funding for the Census Bureau and for them to have adequate tools and adequate practices to, again, ensure a complete and accurate count of all populations, but in our case, primarily the Latino population. Why we focus so much on policy? Because it is these policies that lead to the success or the failure. I'm going to speak a little bit about that in a minute, but I also, like my other colleagues, would like to share a personal story of why today's topic really resonates with me personally and professionally, starting with personal. So I was born in the Dominican Republic. I came to the United States at the age of 10. And in the Dominican Republic, sadly to say, we still have a very troublesome relationship with race. And particularly, we share an island with the homeland of Mita's mother. We share an island with Haiti, and that geopolitical relationship has usually had to do a lot with race. Haiti is a majority Black country. The Dominican Republic is a majority sort of mixed racial country. But sadly, our relationships have always had the contours of race. So what that means is that the Dominican Republic, still today, we have a very, being Black and identifying with being Black still has a lot of negative connotations in the country. It is changing. I'm happy to report that younger populations are much more able to recognize their identity and be proud of their identity and confront those who want to send us backward. But one of the things that I want to share is that, for example, when I started to complete the census for my family first and then for myself here in the United States, I was very proud to mark that my race was Black. In the Dominican Republic, I wouldn't have had that choice. I would have been asked to put myself down as an Indio, which in English is Indian. And in the Dominican Republic, that is a color between white and Black. I don't have that problem in the United States, thank God. So I've been very proud of, and thank God in policy advocacy, good policy advocacy. But I've been very proud that I've been able to mark myself down as being racially Black, and a Latino who is racially Black. And one of the proudest moments for me came in 2020, before we had to answer the census. Actually, after, it was the fall of 2020. Where I actually got very sick. I came down with a lung infection, not related to COVID, related to a bacteria. And I went into my neighborhood doctor just to check. I didn't know at the time that it was a lung infection. And it's an African-American doctor with African-American nurses. And I'm having a lot of trouble walking at this point, let alone sort of write down and fill out a questionnaire at the doctor's office. And so this nurse actually just kind of walked me through it and was filling it out herself. And when it came to ask a question about race, she actually, sorry, I've been asked to, something came up. Okay, sorry, something came up on the screen. But when it came to ask about race, the nurse automatically filled out Black for me. And out of all the things that I remember from that time, aside from being in the hospital for 10 days afterward, was that nurse and the vindication and the acknowledgement and the visibility that I got at one of the lowest points of my life. I was, again, after that, I was hospitalized for 10 days, very close to actually being, having lung surgery. I didn't, but at that moment, since I was one of the most touching moments of my life, and I will always treasure it. So I have a very personal relationship to the work that we do on ensuring that the questionnaires and the other tools that the Bureau and the government use to count the population actually allows our communities to really respond in the way that they feel who they are, with all the richness of their experiences. For example, I have a niece, right? My sister's daughter is half Dominican and her father is Pakistani. So my niece needs to have, at 8 years old, needs to have choices to count herself with the beauty of that combination. To the point that one of my colleagues was making about the superpower of the United States is that diversity. But going back a little bit to NALEO Educational Fund's work, again, we have been working to mobilize our community since the 1990 census to understand what the census is about and to understand how to participate, how to be counted. That work has, again, translated to policy advocacy on this issue. So we work closely together with the Leadership Conference and other organizations to ensure that we're aggregating our power to advocate for policies and for procedures that allow us to, again, keep moving forward in having a tool that lets our populations count themselves, see themselves, express themselves in the way that they are. We're very concerned about how the Census Bureau does its work. For example, in 2020, we noticed that Latinos still did not see themselves reflected in the questionnaires as it was posted at that time. 35% of Latinos in 2020 counted themselves as being some other race. That is a category that is only recognized by the Census Bureau. It is not recognized by other agencies that follow the OMB standards. So it's only for the Census Bureau. So 35% of Latinos in 2020 marked that they were some other race, and 8% of all respondents left that question actually blank. We know that that for purposes of the Bureau completing its work, it imputes race to people, to respondents, when they don't fill it out. So they follow some imputation formula, some of which we've called for more transparency to how that was done. But for us, again, the 2020 census really convinced us that we needed to move to a better way of asking respondents about the race and ethnicity. 27 million Latinos, 27 million out of 63 million that were counted in the census did not see themselves reflected in those race categories, right? So for us, it's very important for the community to be seen, to allow itself to self-respond in the way that their households are actually composed and who they are, right? So that is one of the reasons why we're so committed to ensuring that we have better processes, better tools, a better questionnaire. And in the next few months, in the next few years, we're going to be working to continue monitoring the Census Bureau's implementation of these new OMB standards. Particularly, we're very concerned about how Latinos who are Latinos and Black, like myself, how Afro-Latinos are signaled on the questionnaire that they should see themselves as Latino, but also answer Black. What will the check boxes look like? What will the examples that are cited look like? So we're really going to be working with the Census Bureau as a partner and a watchdog to make sure that, again, members of the community like Afro-Latinos are signaled accordingly, And in addition, that the outreach and education campaigns that the census puts together speaks to the need to educate these communities about how they should be answering the question of race and ethnicity. So to avoid a negative impact on communities like the Afro-Latinos in the Census Bureau, in the Census Questionnaire in 2030 and beyond. Thank you, Sunita. I think I'll take questions now.
So there are questions for you. Indigenous people in Latin America, will they be more visible?
You cut down at the end, Sunita, I'm sorry.
Indigenous people in Latin America, will they be more visible?
There are certain signals in the indigenous that allow for certain groups to like for example, I believe the Aztecs or people from the Andean countries to see they will be signaled to answer there. But I can get back to whoever asked that question with a more specific answer.
Okay.
So yeah, we'd love to get their names so I could follow up.
Absolutely. So I think what we're going to do at this point is ask each speaker for their 30-second soundbite from this briefing. What is the most important thing you would like reporters to take away from your remarks? Juan, let's start with you.
Yes. So thank you so much, Sunita. So the most important thing that reporters, I think, should take away from this conversation today is that this is going to be a long process. And there will be times where the steps that need to be implemented probably will not make sort of big headlines, but are very important to cover. So as to continue to improve things like the checkboxes, those are things that I think this cohort of reporters should really be paying attention to and should stay in touch with us so that we can inform our community so that 2030, 2028, 2029, 2030 don't come as a surprise to our communities.
Thank you. Nita, your 30-second soundbite.
Thank you. I would say that we don't need to think of data as something that happens to us or outside of us, but data collection is a participatory process that we should all partake in and our communities should be engaged in. And this moment of implementing standards and using it as an opportunity to influence what data are collected about us at the state and local level as well is a really wonderful moment to have that opportunity to engage communities in thinking, actually, data collection is a civic engagement moment and we all need to be there and part of it.
Thank you. Dr. Christopher.
I would say that I hope these reporters recognize that we are in a transformational moment in this country, and that all the protests and all the suffering through the pandemic, that it really hasn't been lost, that there really is change happening. And despite the efforts to sabotage that change, we are moving forward as a country to being able to recognize our diversity as our most important aspect of our democracy. So it really is happening. And this moment with the changes that OMB has made, this moment is a reminder that we are moving forward faster.
Thank you. Final word, Tina?
So I'll just start by saying that the OMB's revised standards are a critical first step towards better data to promote health equity and well-being, and high quality implementation of those new standards is critical. As part of that implementation process, federal agencies need to question how systemic racism might be driving their decisions around how they collect, analyze, report, and disseminate their data. And because these standards will influence how researchers broadly collect demographic data, researchers at large need to do the same thing in order to change the system. And only then can data systems inform policies that will truly promote and advance health equity.
Thank you so much to all of our speakers. We're so grateful to the Robert Wood Johnson Foundation for this briefing. Sandy asked me to apologize on her behalf, but she says she truly enjoyed being in the audience. So thank you once again to all the speakers and to the reporters. We'll see you next Friday. Take care.